The Chapter 3 topic I am going to go over today is the prepared childbirth. The first method is the Lemay's method, which the book talked about briefly, but I'm going to explain the 6 principles that this method contains. The Lemay's method first began in 1950s with Dr. Ferdinand Lemay. This is a natural relaxation technique that mainly focuses on a rhythmic breathing exercise. According to Lemay International, the technique's 6 steps are: first, letting labor begin naturally. Letting labor begin naturally without any inductions or flushing allows your body to begin the process when it is ready and not when you want to have it, even if it is not ready. The next principle is to keep active during labor. By staying active, like walking or changing positions, it helps encourage the baby to move into a good position to come out. The third principle is to use a labor support team. This can be a midwife or a doula, or even just having the people that make you comfortable in the room with you. By doing this, it can help keep the mother calmer and more relaxed. The fourth principle is to avoid any non-vital medical interventions. According to this method, by taking any medicines, it can interfere with the body's natural process of labor. The fifth principle is to avoid laying on your back while delivering. They encourage you to use whatever position feels the most comfortable to the mother. And the last principle is for the mother and baby to remain together after birth. This method encourages immediate skin-to-skin contact or breastfeeding to promote bonding with the baby. The main benefit for this method is for parents seeking a non-medicated birth. Without medication, it helps the mother get more in tune with her body and find rhythms that help her manage the birth naturally. There are not many risks in this method. The picture demonstrates the skin-to-skin contact after the mother gave birth to the baby. The next method is a water birth. A water birth is when the mother gives birth to her baby in a tub or a small pool. People usually choose this to help with a natural birth because they think it is less of a shock to the baby's system going from the fluid sac to the water instead of the harsher environment. The main benefit of this method for laboring naturally is the water tends to help soothe the contractions. Even though it won't take them away, it will help make them more comfortable. The main risk for this birth is the drowning of the baby. A baby usually doesn't take a breath until it is delivered and the umbilical cord is cut. But if the cord gets wrapped or snapped from the water and the baby goes to take a breath, it can cause them to inhale the water and even drown. The picture demonstrates a mother in a tub during labor. Next is the Alexander technique. It is a relaxation technique to put less stress on the mother's body. This technique teaches you to lay on your back with your knees bent and your feet flat on the floor to allow your back to relax and open your chest up to be able to breathe better through the contractions. This position is used for more than just if you're having contractions. This is used to help people with their posture and even back pain if they're not in labor. This picture demonstrates the position and how you would look. The next technique is the Bradley method. It is a labor technique that uses a partner or coach as support. This method tries to help the mother trust their body and go through a medication-free delivery. This method starts before actually going into labor. It focuses on the mother eating a good diet, exercising, and researching what is going to happen to her body so she is aware of what is going on. Then at about 12 weeks out, their partner or coach go to a class with them. They learn about the benefits of childbirth, staying away from medication if they can, how the partner can help control the situation and coach them, their breathing, breastfeeding, and scenarios to be aware of during childbirth. Although all the methods I have talked about all reach the same goal of having a medication-free natural birth, they all have various different ways to get there. The picture demonstrates a husband helping his wife comfort her during labor. The next method is hypnosis. It is a method to focus on the positive. By doing this, instead of thinking about contractions, they use different words to describe the same things that are going on. Instead of words like contractions, they use the word surges. Instead of the word pain, they might use the word pressure. This method really focuses on preparing the mind for what will happen and using techniques and words that are positive that will help keep the mother's mindset and visualizations positive. This method also uses things such as massages and gentle exercises that will help make their body go into labor naturally, like bouncing on a ball. This picture demonstrates a mother doing meditation to help her relax. Some things that helps induce labor or relax the body is bouncing on a ball. This motion can help soothe the baby as well as help the baby move down in the body and assist in cervix dilation. Using other things like massages to relax the body and muscles during contractions will help relax you in any point of labor. Also, having aromas like lavender or a scent that is calming to the mother and music that they like are other things that can help the mother stay more calm and not think about the contraction and pain that may be happening. The picture demonstrates a mother bouncing on the ball to help induce labor. The positions shown on the side are different positions that may be helpful in relaxing the body in different circumstances during labor. By squatting, it can help stretch and open the pelvic outlet to allow the baby to have enough room to come out. By kneeling or being on your hands and knees, it can help relax the back through contractions and make it more comfortable to have the baby. By laying on your side, it can help increase the blood flow and may help your baby turn or be more comfortable. And by semi-sitting with your partner's help, it will use gravity to help widen the mother's pelvis, and the gravity will help the baby come out easier. By learning about all the different types of methods and relaxation techniques, it will help the mother not be as nervous and understand that there are many options to get through a natural birth.